You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices with Vicki McManus-Peterson and Dr. Chad Johnson.
Welcome, everybody, to Everyday Practices. Today, I have Dr. John Nosti, who is celebrating 21 years of private practice. Congratulations on that. Dr. Nosti, thanks for joining us today.
Hey, thank you for having me. I'm so thankful to be here.
Yeah, just for those who have been under a rock and don't know who you are, Dr. Nosti practices full-time in Atlantic County, New Jersey, and is the clinical director for the Clinical Mastery Series. He's especially well known for being able to elevate other doctors' practices by simplifying complex procedures like full mouth stuff. His mission is to empower and build confidence in others so that in turn they can do the same. So welcome, buddy. Thanks for joining us.
Hey, again, thanks for having me.
Yeah.
Awesome.
So tell me, 21 years, how did you start practice and where did you, was it in the New Jersey area? I mean, is that where you've been the whole time?
Yeah, believe it or not. So I got out of my residency at Lehigh Valley Hospital in Allentown, PA in like 1999. While I was in my residency, two of my best friends from dental school and we opened a practice from scratch. And then, we each had a job somewhere else in order to keep that office running full time. And the job that I became an associate at later became a partner and then sold out of the practice that I opened up with my best friends. We're still, great friends to this day. And then just maintained that partnership, to this day. And here I am with my partner who's now 64. He's about one and a half years away from retirement. So it's pretty crazy to see that, when I joined the practice, he was probably my age or younger at that time. So it's been a wild ride.
Do you ever get asked in your mind when you think you'll be done? I mean, it's weird to think that you could be halfway through.
Yeah, it's kind of crazy. I mean, I love what I do, but then to look at it to say, okay, well, I am going to be 47 this year. So it's like, wow, I know. Maybe I only have 17 more years, 18 more years. I mean, I could see myself. Yeah. I mean, I could see myself doing it as long as, my body and my health allow me to do it.
Because it's not about a number. I think that oversimplifies it. And it's an easy way to communicate with people. But, there's people think, okay, I'm going to work till I'm 65. Well, what if you're healthier at 65 than you were at 55? Or
exactly.
Or what if, what if you're not? What if at 50, you have an injury that's preventing you as much as our brains want to do dentistry, and maybe our hands could do it, but our shoulders got hurt somehow. You know what I mean? So it's not just about a number, but I was just kind of curious if, so when you've looked back over 20 years, what have you noticed about how dentistry has changed? And what do you notice about the people that are coming to the Clinical Mastery Series about what they're wanting to learn, stuff like that?
So, that's an awesome question. And what's really funny is when I started dentistry, we were really in the midst of fourth generation bonding agents.
Yeah.
Everything was etch. Everything was at least 2 or 3 bottles. And now we're about one bottle and you can kind of ditch etch if you want to on certain instances.
Yeah, right.
On a day-to-day basis, everybody is using a bonding agent. And to see how far we've come with that, that has been one of the things I look at, that's crazy.
Do you remember in the late 90s or whenever, when it was single bond was coming on board and...
Oh, yeah. I remember that. Leaving dental school, it was amalgam versus composite.
Of course.
It was heresy to do a posterior composite back then, And now it's just it's standard of care.
Yes.
Earlier it was, don't use too much light and don't do it too fast. And now it's all about, the faster, more powerful lights. Yeah.
Right. Laser here in 0.2 seconds. No, I'm just
Yeah, yeah, exactly. And you know, I mean, you know what else? I mean, and obviously, what has been done with implants and how that has just literally changed the lives of our patients. You know, that's amazing to see as well.
So I have a question regarding technology. What's been your favorite toys in practice, let's say over the last 10 years, and how have you noticed technology changing?
So if I'm going to do something that's it's either electric or it's like technology, like besides my loops or like electric handpieces, because I do think like electric handpieces that changed the game for me. But
Game changer. Oh, I hate to use that. I'm sorry, huge. Because there's some people that don't like that term. You know, they're saying that it's overused, but it just came out of my mouth. But it's so true. An electric handpiece, especially if you ever go back to using air driven, it's like, how did we cut with this?
Oh my God, it's just like rare, like 30-minute crown prep. Please, I want to shoot myself.
Yes.
But besides that, I mean, if I look at true technology, you know, even like I say, lasers have been around for a long time. So I think one of the things that I use all the time, you know, two of the things are, I would say, joint vibration analysis and TEC scan and T-scan, which is an ultra-thin electronic sensor to measure forces on occlusion. So, you know,
so
and
it's not just marking wear, but it's also showing intensity graphically.
Exactly. So, you know, you look at if you're putting a whole mouth of all ceramic dentistry in on somebody, and, you know, you go to have the patient bite down, and, you know, I think you've all been there. You like ceramics don't mark well until you really start adjusting them. But even still, what do those marks mean? So, you know, when I look at dealing with a lot of all ceramic, cosmetic dentistry, full mouth reconstruction, however it is you want to call it, you know, to me, that's been something that I've used for the last nearly 15 years that I think has been, you know, something that I attribute my success to.
Yeah, very cool. Let's see. There was something else in there. Electric handpieces, T-scan. And you said lasers, of course. Are you Are you a diode kind of stuff? Anything more? What kind of stuff are you getting into with lasers?
So you know what? I feel bad to say this, but I do have a diode and I have an erbium laser, and I think those were really popular in the late 90s, early 2000s, and when the economy tanked, a lot of those companies went away.
Sure.
But you know, I have a VersaWave from Hoya Cambayo, and that company is not even in existence anymore. And, you know, that's been an unbelievable asset in my practice to, you know, do some closed flap osseous recontouring, which is basically, you know, taking away a little bit of bone, right, in order to do some cosmetic enhancements. That's been unbelievable part of my practice.
Mm-hmm. Do you ever use not just loops, because I know you mentioned that, which hopefully most everyone is using these days. Do you use yours lighted or not?
Oh, absolutely. You have to have a light. I mean, so, you know, you kind of look at it like technology, like with a headlight, like as simple as it is, that is, and I don't want to practice without it.
No.
And forget my loops. If something happens to my loops, forget about it. Cancel the day.
You know, I was using loops without a light for years. Well, in dental school, I had a light, and then it was so heavy and just bulky and problematic because it was an early 2000s kind of model. I mean, literally at this point, 20 years old, 18, 20 years old. And then when they came out with these LEDs that you could have that were super small and the little battery packs that come with it and stuff, that was also a total change up where it was nice to be able to use the light. And so I started using the light thinking, well, I don't need this, but I'll give it a try. And wow, then I couldn't go back. So technology, we talked about electric handpieces, lasers, T-scan, loops with lights. What do you go over with your clinical mastery series as far as your coursework? I mean, we're talking full mouth rehab, but give people kind of an idea of what your curriculum looks like, where it is, and how. I'm trying to softball pitch you some answers here or questions, but you know, so tell us a little about that, so that way people can become comfortable with how that looks.
really how we look at it is we are a restorative-based continuum, but we teach you occlusion in a non-dogmatic way. So,
which is really where it's going.
Absolutely.
Yeah.
I mean, there's no reason to take, all of these elevated courses and having a series of 20 courses to learn something. I mean, right off the bat, all of our courses are hands-on. So it's not like you're going to go and spend 2 days and then hear me lecture all day and then have nothing to apply, to practice. It's like from day one, from our ultimate occlusion level 1 course, it's like we teach you the when and why and how of CR dentistry. Like, when is it appropriate? Why is it appropriate? Like, you don't have to do it on everybody, but why you should consider doing it on a certain subgroup of people. We teach you what records to use, how to do a trial equilibration, and then you leave that weekend knowing how to do a 10-unit smile design.
Yeah.
So it's like, go back, start doing functionally driven cosmetic dentistry right away. Because you see tons of those patients in your practice that you don't have to market for. They're just waiting for you to talk to them about it.
Is this a 2-day?
Yeah, most of our courses are 2 days. We really don't do any 3-day courses anymore because, we understand you're taking time. Yeah, you want convenience. You're taking time away from your practice and your family. And, we want to get you in, squirt the fire hose at you, but in a easily to digestible manner, and then have some fun with it, which is so important, and then go home and be able to do it.
So how, I'll admit I didn't know there were multiple courses. How many of these 2-day courses do you have within your curriculum?
So we have our occlusion series is 3 courses. And so the first course, we look at it like, what is the main goal of each course? So the first course in UO1, our goal is for you to know how to do a 10-unit smile design and like when and why of CR. Okay. Occlusion 2 is, how to open vertical predictably and how to do a full mouth reconstruction. And then, but that is on teeth. So we're teaching you really when patients have a full dentition. And then occlusion 3 is like everything in between. What do you do with multiple missing teeth, fully edentulous patients? It's like kind of really brings in the prosthetics of implants to the table for occlusion 3. But that's our main curriculum. But we have, a 2-day treatment planning seminar, which you could take that at any point in time. Hands-on, we go over like 8 cases, plus you get to bring your cases. We give you a system of literally how to take every one of your cases off of the shelf or those models that are sitting on your desk, how to get them off of your desk, treatment plans, and so that you can go and execute it.
Right.
Yep.
And that's 2 days. So that's a 1 course on treatment planning.
Absolutely. And that's 2 days.
Yep. Just wanted to
make sure. Yep. And then really like for the nuts and bolts of like, let's say you come to our occlusion 1 lecture and you're like, hey, okay, I get it. I just saw in a lecture how to do a 10-unit smile design, but I really want to see it done.
Yep.
You can go watch Jason Olitsky, who I teach with. He does a 2-day, what's called anterior aesthetics in the op. And you get to go watch him, like he'll lecture a half a day. And then that afternoon, he preps a 10-unit smile design. Then the next day, he lectures in the morning. And then the afternoon, he seats a different 10-unit smile design. So you get to see 2 different patients, but the smile from start to finish.
Now, these are like you would fly into Newark and then go to your office. I mean, right? For people that are out of the area.
No, so to tell you the truth, we come to you from a lot of the courses. So like our occlusion courses, they're all over the country. Like we were just, in Denver.
I didn't know that.
Yeah, we're all over the place. So
see, isn't it good that we're talking this through so I can know and people can know? I just thought, that we would come to you.
No, so our occlusion course is all over the place. We're just like I said, we're in Denver. We were in New York this year. We've been in Nashville last year.
Okay.
Gone to California, Houston. We go all over the place.
You would potentially come to, big metropolises like Des Moines, Iowa.
Yeah, absolutely.
Okay. Just making sure.
Des Moines' huge, right? You can get like
we have more than one dentist here. Sure. We can have a group. I'm just putting ourselves down just for fun. No. I don't know. So tell me, we've been talking about the technology and stuff like that. So when a lot of people, are trying to figure out whether to choose in-house milling and whatnot, do you like what's it look like as far as the big players? How do I word this? With technology being able to be outsourced, internationally or whatnot, how do you see lab work changing, and what's your go-to? Like, how do you interact with the lab, and how do you see the prospects going on a national level for dentists as a whole?
So that's one of the things. I know every young dentist has a scanner nowadays, and scanning is great. It's an unbelievable technology, but for a lot of things, I'm still going with PVS impression material. I know it sounds old, but
I think a lot of people do that. You know what? I think, for example, if there's Facebook groups, no one says, "Hey, you want to see this PVS impression that I took?" because it would sound sophomoric. But at the same time, like, it's the bread and butter of how things get done. I mean, scanners are awesome. Don't get me wrong, because I'm pro CEREC. I'm all into that. But at the same time, sometimes a PVS just needs to get done.
Yeah, so I look at it like, if I'm not breaking contact with veneers or minimal contact breaking, like, I look at that like that's really good for a PVS impression.
Yeah.
So and I do think that I see the trend for highly aesthetic technicians going up. Like, the ones who are out there, they're starting to charge like a really premium rate because they know that there's because they're rock stars. Yeah. So I look at it where if I was going to go all digital, completely all digital, and do it all within my office, like, to me, I want a ceramist in my office. Like, I want to be the dentist. I want to, prep, cement, dial in. I don't necessarily want to be designing ceramics. I don't know if that's like the best use of my time, and even to like get the best aesthetic result of cutting back and layering the ceramic. But then again, that's just my opinion. I know a lot of people out there are crushing it doing that.
Sure. Well, and it depends on how demanding your patients are, because I hate to say it, but like, sometimes I feel comfortable that, someone in Iowa, this could be a misconception, but I really think I'm right. Someone in Iowa is not going to care as much what their tooth number 31 crown looks like versus someone in LA, and it just is. It's not right or wrong. It's not good or bad. Well, I'll tell you what, it's good for me that, if I'm off a shade, that they won't say, let's redo this. They just say, oh, maybe I'll bleach, and stuff like that. So for sure, everyone loves having 8 and 9 look perfect, but there are places in the country where they want their crown on their wisdom tooth to look perfect.
Right.
Yeah.
Right.
So, hey, let's step out of the operatory for a minute, because we've talked a lot of nerd stuff for the dentists that are listening, but also, just I'm looking more or less also within everyday practices for our podcast to talk about how you've been more successful in life altogether, because I know that things are going well for you, on a professional level. So how do you balance that with your family, and, what's that look like for you after you've taken off the professional hat for 2 hours of the day?
Chad, that is an awesome question. That's something that I've heard from people who were like, how do you do Dental Town? How do you do this? How do you do that? How do you have this many businesses? How are you involved and own a gym? How do you do all those things and then still have time for family? And,
sure.
One of those things that I would say is really important is to understand there's 168 hours in a week.
Mm-hmm.
And, all of us are really good at scheduling our work time. It's like, oh yeah, Mondays I'm 8 to whatever, and Tuesdays I'm here to here. And I think what's really important is you block schedule your home time as well. So,
okay, getting specific, I have a question. Do you use Google Calendar?
So I do, but I'm at this point in time, like I know what my day-to-day
of
hours
course.
are.
Yeah, but I'm just kind of curious if you're a planner like that, because I actually will do that for the listeners as we're recording this and whatnot, before soccer practice and stuff for, our family tonight. I actually I have it in my Google Calendar for family dinner time. We've got, family dinner blocked off on my Google Calendar. So what you're saying, I'm just like, no, I actually literally block it off. But keep on going.
That's it.
Yeah. So
that's it. So that's,
yeah.
Yeah, block it off. So then you know what? When your phone rings and you're blocked off time to spend with your kids, you don't answer your phone.
Yeah.
I mean, it doesn't make a difference who it is. If you have an hour blocked off for dinner or whatever it is, they can wait. They'll leave a message. And if it's really that important, they'll probably call you back 3 or 4 times. And then you can decide whether or not you want to answer it.
It's like, okay, Mom, I'll answer the phone now.
Exactly.
I want to know a personal question here. Do you still call your mom?
So as a good Italian boy, to tell you the truth, man, I live about 9 houses away from my parents.
Excellent.
And as funny as it sounds, we do Tuesday nights, we do dinner at my parents because, a lot of people.
Yes.
You do Friday nights?
Yes.
So the weekend got to be too much of a hassle with traveling, right?
I love it.
So we do Tuesday nights, and like my sister goes with her husband, my kids. It's been something that we've been doing since my daughter was about 1.5 years, 2 years old, and she's 15. So
I have to admit, when I asked that question, as soon as it came out of my mouth, because I thought it'd be a fun, candid question, and then I thought, oh no, I hope he doesn't say, well, my mother and I aren't on speaking terms, and I would have been like, oh, I can't believe I asked that. So I'm glad it worked out, because sometimes that happens. But
it does.
Shoot. So good.
Awesome.
Hey, I have to ask, because you look like you're in shape from your pictures and stuff, and of course Jason's in shape. I'll never look as good as him, that jerk. But so tell me, what kind of workouts you do?
Yeah, so I have to work out a little bit harder than Jason. I think that guy was just born looking that way.
He just looks in the mirror and his hair probably pops right into place. Yeah. And then he's done with the 200 sit-ups just by looking in the mirror.
Yeah.
Man, he's one gorgeous man.
He's a good-looking dude, and he's chiseled. So you know what? I really liked, when I was younger, I was all about going in and lifting heavy and working out for 1 hour to 2 hours at a time. But,
right.
I had back surgery about 10 years ago.
Oh, okay.
And that changed the game. So I really like doing a lot of HIIT workouts, kettlebells, functional training, hit it for about 30 to 45 minutes, get your heart rate up. You could do that 3 or 4 times a week, and that's really all you need to do.
Yeah. No, that's cool. I've got one more serious question here. Any favorite books that you've read in the last year or two? Yes.
And so I'm going to give you 2 if that's okay.
It's totally acceptable, but you want to give me 3 and I will cut you off right now. You give me 2
All right.
tops.
I'll just give you 2. All right.
Okay.
So in the last year, I'm going to say David Goggins' biography, Can't Hurt Me. Definitely have to read it. Okay, I'll give you a quick synopsis. The guy at one point in time was the world record holder for pull-ups in a 24-hour time period.
That's where I've heard his name. Yeah.
He is a former Navy SEAL. You just have to read his story or listen to it on Audible, because it's great on Audible.
Because he reads it himself?
He actually has. So on Audible, it's like an interview. He has a guy who reads it for him, and then they stop at some point in times and they interview David about his life.
Yes.
And it's exceptional. The guy. So if you think, mind over matter, how it is that you feel, this guy really shows you what you could do with your mind. It's crazy.
That's awesome. So I'm looking at that. Defy the Odds, Can't Hurt Me, Master Your Mind. Very cool. Okay. I need to check that out, because I heard his name. It was a couple podcasts ago, and it might've been Chris Moriarty that was talking about him. But then we were, looking it up, and I never got around to checking into his details more. But Audible, check out David Goggins. Okay, what else you got?
Yeah. So the other book, and this one's a quick read, and I'm going to tell you, so that one, so Goggins' book is more for your personal life, for you to really hit it and get motivated, understand what's going on and how you can control your mind. But one that I think is really good for a dentist to really master, and it's a 4-hour Audible book. I did read it, and it took me like maybe a half a day. Yeah. It's called Change Your Questions, Change Your Life by Marilee Adams. And I recommend this book all the time. Almost every time I speak, I recommend it because I'm big in sharing and like helping to elevate others. And what I could just say about that in a quick summary is that book is responsible for more case acceptance, for more, I say more, but for better communication with my patients and my practice. Yes. To discern any arguments that's been happening between like an employee and a patient, or even misunderstandings between patients and myself. That book has just been absolutely unbelievable, and I highly recommend it.
Very cool. Well, I'm just getting so much out of this. I hope the listeners are too. So I have one more question. We were talking about favorite books, and that's always a good content question. I'll admit this one's just silly, but we just have fun with it. Okay, so you're going to have to roll with it. You get to choose one or the other: bacon or eggs. Oh, I know.
Bacon.
Wait,
no, actually. I got to go back. It's got to be eggs. It's got to be eggs.
Okay, so it's basically 60% eggs, maybe 40% bacon. Because, I mean, It just seemed like you were kind of on the teeter-totter. So I'm going to mark it down with a little asterisk next to the bacon that you chose the healthy option with eggs. We've got it marked down. So if anyone ever wants to know, we've got John Nosti on the record, eggs, but maybe bacon as a secret sinful delight.
Well, here's the reason why I chose eggs. Because in New Jersey, we have this thing called Taylor ham that people call pork roll. So you could go without bacon, and you could still have your eggs, and then you could cheat and have pork roll. So that's really why it's got to be eggs.
When we were interviewing Mike DeTola, he talked about the pork roll. So listeners will have to go back and listen to DeTola's talk about pork roll. That's funny.
Listen, man, if you go out drinking at it, at night, and the next day you're a little bit hungover, there's nothing like a pork roll, egg and cheese on a hard roll that's going to set you straight.
There you've got it. Now you're ready for your workout, your HIIT workout on Monday morning.
Absolutely.
Well, John Nosti, I've hopefully kept it right here at under a half an hour, and I really appreciate you spending some time away from family, away from practice to talk this stuff over. I hope this helps sharpen other listeners because I've really taken a few good notes. I've literally, if you can see on my paper here that I'm holding up, I've literally taken notes off of just the stuff we've talked about, and I really appreciate you coming on and talking this stuff over. Do you have any closing thoughts for our listeners?
That's it. Just, I'm sincere when I say I like to help other people. Anytime people have a question about a case, feel free to hit me up at drjohn@clinicalmastery.com. You can go post it on Dental Town, which, I'm on there frequently. Yeah. And then, if you're really trying to elevate your practice, I would definitely recommend that you check out the Clinical Mastery series. And that's just www.clinicalmastery.com.
Yeah, thanks for throwing that in there. And then we'll also throw that in at the notes at the bottom for the written part in case you guys are on the bike or on the drive to work or on a plane to CE or something like that. That way you can pick that off at a later time. So Dr. John, thanks so much for joining us today. And I promise you that I'm going to make it happen. I just don't know when, but I'm going to make this Clinical Masters series happen with you and me together.
All right, Dr. Chad, I appreciate it, man. Have a great one.
All right, buddy. Later. Thanks. Thanks for all our listeners today for Everyday Practices as well. We'll see you on the next episode.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with Everyday Practices.